Hi, Scott. How are you today?
Great, Tara. How are you doing today?
Doing very well. It's a beautiful day right here. So let me just take a moment to introduce ourselves. So I am Tara Bruner. I am a clinical educator with Thermo Fisher Scientific, and my role is I'm a practicing physician assistant, and my role is to speak to providers about all things blood allergy related. And so you are my colleague as a PA and clinical educator. So introduce yourself, Scott.
Oh, thank you, Tara. So, yeah, as Tara said, my name is Scott Duhaime, and I've been a PA for over 27 years now, and that was divided up between lots of areas, including the military, as well as on the faculty at the UT Health Science Center in San Antonio. And I'm coming to you today from Austin, but since 2015, I've been one of the clinical educators, just as Tara said, with Thermo Fisher Scientific.
Right. Yeah. So we get to share a lot of conversation. We travel a lot. We do a lot of conversations, but I'm coming to you from Arkansas, and I thought, today's discussion would be a good conversation to have outside. So we are a balmy 80 degrees and climbing here in rural Arkansas. What's the temp doing for you there in Austin, the good old Austin, Texas?
It's raining today, but we needed to
Ah,
wash everything away. So yeah, but it's still warm. It's always warm in Texas in summer.
yeah. Speaking of that, our conversations today about climate and weather, maybe some of that's the weather maybe from Alberto. Is that Hurricane Alberto headed your way, or maybe some spinoff?
I think it's some spin-off from that early
Yeah.
on.
Yeah. Well, yeah. So today is really trying to figure out, kind of our environment with pollution and climate. And, when we talk about climate, we're talking about, that's more cumulative. And then we talk about our weather patterns, which is more day to day. But I know I'd like to open it up to you to introduce some scientific evidence regarding our conversation today.
Absolutely. Yeah. Well, thanks, Tara. So, this topic today is somewhat timely because, I just was recently reviewing one of a great article that was published last year in Immunology and Allergy Clinic by Doctors Lee and Ramsey. And in this article, because, this article was talking about climate change and food allergy. It actually was titled Climate Change and Food Allergy, and explains some of those ways that pollution is affecting the population in industrialized the United States. And the paper also talked about pollination pattern changes due to climate change. But really, one of the highlighted features of this paper was the epithelial barrier hypothesis. I'm sure, Terry, you've heard of that in your professional as well as probably in your non-professional and just regular conversations as well. I'm sure you've a couple of times.
Yeah, I've heard that. I've heard the barrier. Kind of. We've got to keep things in. We got to keep things out. I'm really interested to hear more about this conversation because we talk a lot about barriers or the airway when it comes to pollution and climate and pollens. But tell me more about this climate change and the food allergy that you were discussing and this epithelial barrier.
Epithelial barrier hypothesis. Yeah. So what the
Yeah.
paper talks about is that, well, we have it laid out some of the ideas of how the epithelial barrier just toxins that are in the air, toxins from pollution can affect that epithelial barrier and can cause over the population some increased rates of allergies, not just our regular respiratory allergies like rhinitis and runny nose and asthma, but also food allergies and increase the rates of food allergies. And the theory is that exposure to these toxins disrupt that epithelial barrier. And again, it's a hypothesis, but one of the hypotheses that are out there as to why we have this increased amount of allergies in the industrialized countries.
Right. There was a comment that said we're seeing foods more and more and more. And, this is one more hypothesis, like you've been saying, this epithelial barrier hypothesis, because we have other hypotheses out there as to why we're seeing more and more allergies, respiratory, food, etc. And some of those are like the hygiene hypothesis. Maybe in industrialized countries we're a little too clean.
Yeah.
Maybe it's the antibiotics that we use too many of, or maybe it's we're not in the dirt and soil like we used to be. So yeah, this epithelial barrier and how does that play into this whole discussion today?
Yes. So yeah, you're right. The hygiene hypothesis is one theory that we have, but this is a completely different theory. And really what this goes in to say is that, we have this fantastic epithelial barrier, whether it's on our skin or it's in our respiratory tract or even our gut, our GI tract. And they have a barrier that keeps things in and then keeps things out. But some things can affect that epithelial barrier. Some things like toxins, like some of the CO2 or other pollutions and particulate that's in the air. And when it does is it'll affect that barrier and disrupt that barrier, which will really do what we kind of think of as three things that it can do, three buckets of things that it can do. One, it can let in proteins or allergens that otherwise would not be able to enter those areas. Two, it can cause some inflammation in the epithelial barrier and therefore cause inflammation below that in our system. And then three, it can also allow other things that are what we call opportunistic pathogens, not just proteins like allergens, but it can cause other things that shouldn't be in our intake based on the fact that the pollution or the particulate matter affects that epithelial barrier.
Yeah, there's some conversation that we're hearing from this article. This is, a population. This is a study looking at a certain population in a certain geographic area with certain, parameters around it. So how do we think about this as individuals? We're sharing a similar environment depending on where our geographic location is, urban versus rural, et cetera. How does this affect us as individuals? How can Tara, how do I think through this as an individual?
Yeah, so again, this is one of the hypotheses that is out there on how we have these increased rates of allergy, in our industrialized countries. But on the day-to-day level, when you're talking to an individual, like talking to a patient or talking to somebody on the Instagram Live, if we would have them in front of us, how would you be able to affect, is what you're asking, right? Because we can't live in a bubble, so
right, exactly.
But what we can do is on a day-to-day basis, we can control the controllables. What do we have
Right.
that we can? Now we have some things we can't control. Again, all the particulate that's in the air, all the pollution that's out there, and that's inflaming our airways and our GI tract. But what we can control is finding out what we're actually sensitized to, allergic to, and that things once exposed can cause inflammation. Other things can cause inflammation in your universal airway or lower airway, as well as in your GI tract too. So keeping that, but the way about that would be more what we call the cumulative effect. You have the cumulative effect of all these different things that can affect us. And once we identify not just the ones that we think we have, such as maybe cat, dog, or dust mites or whatever, but what about the ones we don't know? So if you kind of think of it like a glass, if you have a glass of an empty glass, a 16-ounce glass, and you start adding different liquids into that glass, one liquid might represent cat allergen, another liquid might represent some pollution that can cause some inflammation, another one might be cigarette smoke or secondhand smoke. Pretty soon the glass is going to overfill, and that when that's overfilling, that's an analogous to somebody having a respiratory symptoms, whether that's lower or upper respiratory. So,
Yeah, becoming symptomatic, whether that's, in the respiratory symptom area, that's coughing, or maybe you have asthma and wheezing. Maybe it's the simple runny nose and itchy mouth. Maybe it's your eyes watering and I think they've said the faucet running, the nose and the eyes. So yeah, that's the controllable. So to put it seems sometimes when we talk about climate and pollution, it seems ominous, like I can't control pollution. But bringing it back into our controllables is understanding that and knowing that and being able to do that. So I think I like that phrase of control the controllables.
Absolutely.
And really knowing of those three, pollution, weather or climate, and allergies, know your allergies.
Yeah.
Absolutely. Yeah. Good point.
You might think this one, that one, but there's so many what we call hidden allergies, right, where you have some inflammation from that. So that's where we talk about how our respiratory or how our whole system is affected by that pollution. So let me ask you, Tara. Let me ask you what let's take the other side of that. Let's talk about weather changes and things. How do you feel like if you had a patient sitting in front of you in the clinic and talking to them about weather and how that affects and the different weather changes, how that affects them on their day-to-day life? They're not living in a bubble.
Yeah, I appreciate that comment because, we're coming kind of out of pollen season, if you will. We usually think springtime, but really there's pollination year round. And so right now it's grasses, that are really pollinating. The trees are still pollinating. So being able to test for that. So there are different methods to be able to test for outdoor and indoor allergens that really pertain to the respiratory tract. Yes, there's other testing for foods, but there's the traditional skin prick test. There's even blood allergy testing that can be very valuable, that you can ask your provider. That's just a simple or convenient blood test that you just get a simple, venipuncture or blood draw that can help reveal what maybe you may be, allergic to, because what I'm allergic to is going to be different than somebody else. And so I often say it's nice to name it. Like you said, we can usually say, yeah, I think it's this allergy. But there's this hidden allergies, maybe it's dust mites, maybe it's molds that you don't see in your environment. And so being able to name it for that individual, for that patient is able to, like you said, control the controllables. Okay, I know I don't have to worry about springtime when trees are pollinating. I really need to worry about fall when weeds are pollinating. Or maybe I don't have to worry about the dog or the cat. I really need to focus on dust mites. And, I want to bring this conversation really maybe back to some of this climate or weather patterns. So it's raining there in Austin, and we're talking a little bit about, maybe some of these timely conversations of flooding or hurricanes that can leave a lot of mold, mildew. It can even leave things like a high humidity. And those things are very, very good environments for things like molds to grow, as well as dust mites. So in certain situations, you may not have issues, but after weather patterns, you may have more. We're also noticing, you may have had allergies in the past, but maybe it's not just in the springtime, maybe it's lengthening. And sometimes we're seeing our pollination seasons lengthening because we're not having, there's again theories, but we're not having, we've got flies out here too, but we're not having things like these hard frosts that are, it's changing the pollination, and we're having longer pollination seasons. Even things like thunderstorms can stir up some of these pollens, even kind of pulverizing some of the grass pollens and distributing them differently. So we can't always have this, I know exactly what my allergy is. I know exactly how to control it. What we can know is if we identify what allergens are pertaining to us and really be able to monitor that with tools that are already out there, like pollen.com or pollen monitors, that you can get through different weather apps or channels, even air quality. So you can monitor things like this. So there are options that we can do that I recommend for patients as well as friends, and even my daughter who deals with this, is we've got to monitor and control what we can control, name it, and then really take ownership and know how to control the controllables. Yeah. And I'm even going to put a plug here. So if you're talking about pollution, don't smoke, don't vape. You're putting that pollution just right. You're just putting it right into your respiratory tract. And so you talk about that 16-ounce glass. It's already overflowing before you ever put any of those other things in there. Absolutely. But those are some of those things, like you said, you can control.
Absolutely, Tara. I totally agree with that. Smoking and vaping, you are literally just directly adding to the glass. You're taking a 20-ounce glass of something, trying to put it into that 16-ounce glass, and you're just going to symptoms. And so anything else that is out there is just pushing you further and further down that respiratory that reactivity in your respiratory way, especially the vaping too. Anybody who ever thought it was a good to aerosolize plastic, have you inhale it? I don't know how we ever came up with